Hello, my name is Gretchen Jackson. I'm an advocate and trainer for the last 19 years, first at the Advocacy Center and now at Starbridge. In this module, I will be discussing the New York State Special Education Continuum of Special Education Services. This is the range of possible special education services for children with disabilities that have been classified through the CSE process. The objectives in this module are to increase knowledge of least restrictive environment, or LRE, increase understanding on how the location of special education services is determined, increase knowledge of the New York State Continuum of Special Education Services, and to increase understanding of how to be an equal member in the CSE process. So where do we start on deciding appropriate special education services? We start with the needs of your child and the Committee on Special Education. It is here where appropriate special education services will be determined for your child and become a part of your child's IEP. The CSE must look first at providing these services in accordance with the Individuals with Disability Education Act, or IDEA, in the least restrictive environment, or LRE, before looking at a more restrictive environment. IDEA states least restrictive environment as providing, to the maximum extent appropriate, children with disabilities, including children in public or private institutions or other care facilities, are educated with children who are not disabled, and that special classes, separate schooling, or other removal of children with disabilities from the regular education environment occurs only when the nature or severity of the disability is such that the education in regular classes with the use of supplementary aids and services cannot be achieved satisfactorily. A New York State Education Department memo distributed in December of 2015 reinforces New York's commitment to continue to increase opportunities for specially designed instruction and related services in the least restrictive environment for students with disabilities as based on IDEA. This memo was sent to all school districts in the state. One part of the memo reads, "The purpose of this memorandum is to seek the immediate attention of parents, school districts, and communities to maximize participation of students with disabilities in general education programs and to ensure that students with disabilities are being provided with opportunities to receive high-quality instruction in the LRE. Specifically, the department recommends that each school district first engage in a district and school data review and analysis relating to LRE. Second, ensure that all full continuum of special education programs and services are available for all students with disabilities. And number three, assess and address the extent to which each of their schools provide high-quality inclusive settings as defined in this memorandum." If you would like to learn more about this memorandum and read the entirety of it, you will find the link to this in your resource section of this module. Special education is a service, not a place. IDEA supports that special education is not a place. It's a set of services and supports where a child with a disability receives special education services. That's the child's placement. The New York State Education Department Part 200 regulations and also the New York State Education Department's LRE field memo reinforces IDEA. As you look at the Continuum of Services triangle, you will see that the least restrictive environment, or LRE, is at the bottom. The bottom of the triangle, which is the largest part, represents where the majority of all children in the school are educated, and that is the regular education classroom. As you go up the triangle, it gets smaller, and each line represents a more restrictive environment for classified children to be educated in, because each step has fewer, if any, regular education students in it. The CSE must decide first if a classified student's needs can be met in the regular education classroom before considering a more restrictive environment. Remember, you are an equal member of the CSE and your input is important in this decision-making process. So the IEP and the LRE decision-making process. When making the decision on the appropriate special education services to meet the child's needs, the child's IEP should be looked at closely. First, any evaluations that have been done on the child should be looked at. Next, the child's present levels of performance, or their PLEPs, should be looked at carefully. It is in the PLEPs that describe a child's current strengths and needs. These should be well defined based on the information gathered from evaluations and throughout the school year. The PLEPs look at academics, which include all subject areas and functioning levels, interests and preferences, instructional supports and services, accommodations and modifications that have been used. PLEPs describe what has worked and what hasn't worked. PLEPs look at the social needs of the child. How do they get along with others, both peers and adults? What are their strengths and needs in these areas? Are they leaders, or do they need appropriate role models to learn appropriate behaviors? PLEPs look at physical needs, the child's motor and sensory development, health and physical skills, and how they all relate to learning. And PLEPs look at management needs of a student. Does a child need any certain material, resources, braille, large print, colored paper, a computer, and environmental modifications such as an FM system, fewer pictures on the walls, certain lighting, or does a child need human resources like a person to help transition a child from one location to another, to help a child with a behavior plan, or to help keep the child on task? Be sure as a parent that your child's PLEPs are well defined, because your child's special education program will be determined with what they say in them. Look at the goals and objectives to see what type of environment they could be met in. They could possibly be met in many different environments. Then look at the special education supports and services the child needs to be able to progress on his goals. LRE determines what constitutes an appropriate program for the student, not what pre-existing program fits best. Consider if the student can make progress on their IEP goals in the regular education classroom. The CSE should start with this, by examining the regular education classroom placement as the first option as required by IDEA. There should be an in-depth discussion on whether the student can be educated satisfactorily to meet their needs and progress on their IEP goals in the regular education classroom with one or more of the following: supplementary aids and supports, accommodations and modifications, consultant teacher education services, assistive technology, training for staff, an aide or a teaching assistant, a functional behavioral assessment or a behavior intervention plan, FBA or a BIP, or etc., something that may be unique to your child that needs to be looked at. During the LRE decision-making process, it is important to remember that IDEA states that a child with a disability is not removed from education in an age-appropriate regular classrooms solely because of needed modifications in the general education curriculum. Also, in this first part of the LRE process, the child's needs and goals should be looked at closely to see what environment they can be achieved in and why. Some children's needs and goals can be achieved in the LRE because of the role modeling of typically developing peers and the regular education enriched environment. Some children may have needs and goals similar to the following that could possibly be met in the LRE. Possibly the child has a goal that says student will participate appropriately with other students their age. Students' needs to become more aware of their environment could be a possible goal. Other goals could be child needs to learn to take turns with their peers, increase vocabulary, they practicing to remember, listen, and share ideas. Possibly their goals could say things like increase task commitment, learn to follow directions, increase receptive and expressive language, build peer relationships, Any of these goals that we've just discussed can be met in many different environments. They could be also met in special classes, but they could very easily be met in least restrictive environment classes or regular education classrooms. The next discussion to have in the LRE decision-making progress is to compare the benefits in the regular education classroom and those provided in a special education classroom or segregated setting. These will be unique to each child. In the areas that should be looked at would be academics, communication skills, peer role modeling, and social. Compare social and communication skills benefits in both settings as well as the academic benefits. Compare the relative benefits for the student in each setting that will enable them to progress on their IEP goals. Keep in mind that regular education classroom placement is not dependent on the student's ability to learn the same things in the same way as the unclassified student. The last discussion to have about LRE as you're in the CSE process is to consider the potentially beneficial or harmful effects that a regular class placement may have on the student with a disability. Positive benefits might include social interaction with typical peers, peer modeling, high expectation, acceptance of others. Harmful effects might include unduly disruptive behavior that impairs the student's learning or that of others, even with the implementation of a behavior intervention plan. Consider each of these three factors equally. What are the management needs of the child? What's the pace of the curriculum, and could it be modified for this child so they would be successful? How about the self-esteem of a student in different settings? Which setting would be the best for the child? All of these are important aspects to consider. The way that a student can be supported in the LRE and the Continuum of Special Education Services are the following. A consultant teacher is a service to help support a student in the LRE. A consultant special education teacher works in the regular education classroom with the child in the subject areas where the child needs special education support to be able to benefit from the regular education classroom. The consultant teacher can work with the student for a minimum of 120 minutes a week. There's no maximum time. The time is based on the child's needs. The consultant teacher services can either be direct, as working with the child individually, or in a small group, or indirect, such as working with a regular education teacher and other team members. Direct and indirect time should be listed on the student's IEP. Related services can also be provided to support the student in the LRE to be able to access the general education curriculum if the student qualifies for those services. Speech, interpreting services, orientation and mobility, assistive technology services, to name a few, are related services that could support a child in the LRE. Integrated co-teaching is out of the regular education classroom, but this option still allows for a student with disabilities to be educated with other children without disabilities. Districts do not have to provide an integrated co-teaching option, but most districts now do. This option is a classroom of students with disabilities and students without disabilities being co-taught by both a regular education teacher and a special education teacher. There can be no more than 12 classified students with disabilities in this classroom. All the other students must be unclassified regular education students. Students can spend their entire day in this classroom or just in there for certain subject areas that they may need extra support in.